Hi, this is Dave Shern. It's great to be with you this afternoon, and we're introducing a new feature, and that's going to be a video that will accompany News from National, in which I'll provide you with a sort of a brief update on many of the things on which we've been working. And I'd like to kind of organize that into three categories. One has to do with national leadership, the second has to do with what we're doing with regard to the affiliates, and then finally talk a little bit about some of our advocacy/public education activities. In terms of national leadership, we've had really two activities ongoing that we're very excited about. The first is an initiative with the White House. We've had two face-to-face meetings with Mrs. Obama, Dr. Jill Biden. Joe Biden's wife was at one. Mike Mullen and his wife, Deborah, were at one of these meetings. And working with the White House as well as colleagues in the affiliate network from New Jersey and Texas, as well as faculty from the University of Medicine and Dentistry in New Jersey, we're developing what we think will be a very exciting peer-run program designed to provide a very friendly front door for veterans, active duty servicemen and women, their families, as well as people who've completed their service, to access and help navigate the services environment. Stay tuned for further details on this. We're still in the process of trying to design a funding strategy for it, but are very optimistic that with White House involvement and some of our other partners, there'll be some good news to report about this soon, probably at the national meeting. Second thing I'd like to focus in terms of national leadership is the production of a situational analysis that we've done in collaboration with the National Association of State Mental Health Program Directors and Vanguard Communications. And the situational analysis relates to the development of a national framework for implementing prevention and promotion throughout the United States. We produced a document in which we detail what we believe to be a compelling case for the importance of implementing our very powerful science in prevention and promotion, not only to drive down the rates of mental illnesses and addiction disorders, but really to help to address some of the most important fundamental problems that we as a society are facing around slipping academic achievement, slipping competitiveness, and really very poor health status relative to many other countries in the world. So I recommend that to you, and preview that we'll soon be working on some implementation strategies, producing some webinars for the affiliate field in these areas to try to generate interest and hopefully prepare us for what may be a new formula grant program available to states next year to implement prevention and promotion. In terms of affiliate services, we've just completed two national call-in hours with affiliates, well attended, in which we described activities at the national office, particularly in light of some of our recent staff reductions, as we try to right-size the organization for our current budget, and also implement several important initiatives that we're confident in the long run will build our organization both nationally and through the affiliates, build our national movement, and engineer its ongoing and continued success. As part of the affiliate calls, we also talked about the work that we're doing to re-engineer the national meeting, which we'll have in Washington this year in June. Look forward to the 2012 meeting being in San Diego as we try to start moving the meeting around the country to hopefully encourage participation, perhaps move to some less expensive venues. This year, the annual meeting is going to have three tracks that have been specifically designed to appeal to the affiliates as well as to others. One is going to relate to new ideas and new funding. And there we're going to talk about follow-alongs to our fundamental health activity. We're going to introduce some new technology that we've developed in terms of web-based technology and personal data device technology to help people with depression and PTSD, as well as talk about the Veterans Initiative and the hope that we have there for ongoing affiliate-supported affiliate activity in this area. Second track in the national meeting is going to relate to work that we've been doing in the peer specialist area. We'll be bringing in experts from around the country, and it will be a sort of a peer specialist program from soup to nuts to help people who are interested in developing, launching, and sustaining peer specialist programs in our affiliates to sort of a cookbook about how one might be able to get that done. And then finally, we'll have a track with lots of national leaders on healthcare reform. We'll talk about what's happened over the last very, very busy year in getting ready to implement and in implementing components of the Affordable Care Act, and provide some examples from states around the country as well as from the District of Columbia about experience that they've gained in trying to expand Medicaid programming to larger populations. Some very interesting, important opportunities, and the role of advocacy is going to be critical in the states in assuring an adequate benefit package for the large number of people with mental health and substance use conditions who are going to become eligible for Medicaid when it expands to 133% of the poverty level. So, affiliates, annual meeting, strong bond, and we hope many of you can attend that meeting. We've tried to cut the expenses associated with it to make it more accessible and available. We're also very excited to be moving into May as Mental Health Month. As you know, we started this about 50 years ago. It's now a national movement where all advocacy organizations participate in one degree or another. We've sent out to the affiliates their toolkit, and we're hoping through May as Mental Health activities to do what we always do, which is raise awareness, and then secondly, to also continue to build our national membership program, which is one of the strategies we're using to build a more powerful movement through the development of a real populist movement, one that's supported by the general public, and we're hoping that there'll be lots of opportunities there. We're also working on a potential collaboration with a national retailer that we can't discuss yet, but we hope to, by the June meeting, have this well underway and we can feature it for those of you who can participate. Finally, in terms of public education, I've already talked a little bit about the fact that we're taking our Dialogue for Recovery program and we're really trying to put it into a very engaging, interactive, computer-based program that people can use, focusing initially on depression and PTSD, working with a very skilled group of software developers who've developed many successful iPhone applications, combining that with more traditional web presentations in order to develop a tool that we hope will be very helpful for people and also will have some commercial appeal that we can use to continue to sort of drive our mission and build out our business model. So as you can tell, there's a lot going on at the national offices. It's a very exciting time. I just feel that we are so well positioned as an organization right now with the major themes in healthcare reform and really the major challenges that our country is confronting, that this is our opportunity to sort of seize the leadership role that we've had traditionally and move many of these important conversations forward. We'd love to hear from you. Any feedback about our little video clip addition to News from National would be appreciated, and we'll look forward to talking to you again soon.